Welcome, ladies and gentlemen. I'm Dr. Silva. Thank you for joining me. Today, I'm going to talk to you about the PRN use of SSRIs, taking medications like Prozac and Zoloft and Paxil and Lexapro only as needed as a way of avoiding side effects you would otherwise likely incur taking those medications every day. What conditions and specific symptoms you can get away with addressing pharmacologically using this strategy, and which of the SSRIs is best suited to the task. There's one that works much better than the others in this regard. I had a disagreement with a family member recently, and during the argument, things got a little emotional. I started to take things personally, violating one of the 4 agreements, see Don Miguel Ruiz, and I got defensive and then actually angry. And in retrospect, I realized that it had to do with my need to be right, my easily bruised ego, feeling dismissed and condescended to, which were no doubt my own projections. Because of my temperament, who I am and how I react, being told that I was wrong simply because my family member chose to disagree felt very uncomfortable. Ultimately, my inner narcissist couldn't take not being recognized as not only being right, but being smart enough to not misunderstand the issue at hand, which was actually not a matter of opinion. No one was saying anything about my intelligence, but that was my inference, my subconscious inference or preconscious. I was frustrated that I was unable to explain it well enough to prove what I was saying, but the hurt that, unfortunately, because of my temperament, quickly boiled over into indignation and manifested as frank anger, i.e. narcissistic rage, came from my perception of being disregarded and disrespected, when of course that was not the intent. No one was disrespecting me. But that was my perception in the moment. My fragile self-esteem felt threatened, not being believed, not being recognized as being in the right. I was triggered. So I psychoanalyzed all that after the fact, almost immediately, just as soon as we got off the phone, and I felt badly about it, immediately. I should also mention that I suffer from OCD, and part of the tension I feel in situations like that has to do with the anxiety of not properly settling a matter and letting the other person go about their life unconvinced of the truth. I feel a compulsion to settle the debate that has less to do with pride or ego. Afterward, I had trouble letting go. I wasn't angry anymore, but it bothered me so much that we had had a spat that at first I didn't know what to do with myself. I was literally beside myself. And eventually I decided to fire up the sauna, lie down, and meditate. But I had trouble banishing the thought. I kept imagining and even saying out loud better arguments with clearer examples I wished I had thought to use. And even though I tried to stop thinking about it, take deep breaths and concentrate on my body and the heat and various aches and pains I was dealing with, my mind kept taking me back to that pain, the emotional pain of having felt that way, and worse, having reacted in such a manner, defensive and angry and aggressive. Now, I have OCD, so my threshold for obsessing is significantly lower than the average person's. One could say that, by definition, my baseline allows for compulsive thought patterns, just at my best unmedicated baseline. But I'm not unmedicated, and moreover, what I'm going to talk about in terms of dopamine versus serotonin is true for everyone, whether or not you're taking medication, but especially if you are. Besides the psychology that explains my emotional reactions and my behavior, there's the neurochemistry in which it's based, without which there would be no emotions. And we can't properly understand the situation and its aftermath for me without also knowing that I had taken my medicine that morning, which included the serotonergic medication Zoloft, recently increased due to a separate situation which was causing me a lot of anxiety, and the dopaminergic and noradrenergic Wellbutrin XL, likewise recently increased to see about improving energy and motivation after having taken it at a lower dose for many months. And I'd also had a cup of coffee. Those medications work very differently, Zoloft and Wellbutrin. They have disparate mechanisms of action. They increase different neurotransmitters, and they target completely different symptoms. Zoloft increases the actions of serotonin, Wellbutrin increases norepinephrine, also called noradrenaline, and dopamine. Zoloft and Wellbutrin, in fact, can each cause or exacerbate the symptoms the other is designed to treat, from anxiety and irritability in the case of bupropion to lethargy and somnolence as a result of taking sertraline. The problem is that Wellbutrin exacerbates my anger, and the increased dopamine and norepinephrine exacerbates OCD as well. After the call, I wasn't angry. I felt guilty about losing composure, but I was obsessing. I had to redirect my mind a dozen times or more. What would have helped me is to have taken an extra dose of Zoloft, a PRN dose. PRN, from the Latin pro re nata, literally for the thing born or for the matter arisen. PRN in medicine means as needed. So for example, you might take Ambien at bedtime PRN, not all the time, just as required whenever you can't sleep. Today, I'd like to talk about the PRN use of SSRIs, selective serotonin reuptake inhibitors. This isn't talked about. What you hear is that to treat clinical depression or endogenous anxiety or even adjustment disorders with depression and anxiety, you have to take the medication every day, and you have to take it for several weeks. To a certain extent, that's true. There are certain conditions such as generalized anxiety disorder, panic disorder, OCD, social anxiety disorder, major depression, bipolar disorder, that during an acute episode, or if it's a lifelong condition, it is necessary to take the medication every day. It can actually be worse to take it and not take it and take it and not take it. So consistency is very important. And we always tell patients you have to take your psychotropic medication every day without fail, and you shouldn't abruptly stop taking it. But the target symptoms and the specific conditions comprising those symptoms are what dictate what the best class of medication will be and what the best course of action is. So for example, if a person is experiencing severe depression that's characterized by lethargy and anhedonia and anorexia and hypersomnia, those are neurovegetative symptoms, physical symptoms. So that individual is likely suffering from major depressive disorder and should be taking an antidepressant every single day for months. I'm not talking about those individuals. What's not talked about is the fact that you can take medications like Zoloft and Paxil on an as-needed basis for certain symptoms. There are certain symptoms that respond immediately to those medications. Now, this is not entirely unknown because for years we've recommended that women during the late luteal phase of their menstrual cycle who are experiencing tearfulness or irritability or despondency, less commonly anxiety, on those days can be successfully treated just on those days. Even women with premenstrual dysphoric disorder, PMDD, whose symptoms are severe, debilitating even, can take medication just on those days. Fluoxetine, famously known as Prozac, was marketed just that way by the makers of Prozac for just that indication under the brand name Sarafem. Now, the current recommendation is that it's probably better for a lot of women to take medication every single day of the month, depending on individual circumstances. Certainly, those with PMDD are probably better off. Fluoxetine has an exceptionally long half-life, so it takes a longer time to achieve steady-state blood levels. It takes about 4 to 5 weeks for fluoxetine and its active metabolite norfluoxetine to reach steady-state plasma concentrations. However, by around 2 weeks, around 75% of steady-state concentrations are reached. So Eli Lilly, the makers of Prozac and Sarafem, recommended one of two methods: taking the medication every day, or starting the medication 14 days before menstruation and taking it through day 1 of a woman's cycle. And with that data, they were able to demonstrate to the FDA that fluoxetine works to alleviate the symptoms of PMDD and get formal approval in July 2000. Fluoxetine taken for half the month still works for the dysphoria of that syndrome because it also takes 5 half-lives to completely clear a medication. So with that schedule, Sarafem levels would stay between 15 and 60% of the normal steady-state concentration if we assume that fluoxetine follows first-order elimination kinetics, meaning a fixed percentage of the drug is eliminated over time, which fluoxetine actually does not. Fluoxetine follows nonlinear kinetics due to enzyme saturation and the active metabolite, and the fact that both fluoxetine and norfluoxetine are potent inhibitors of the cytochrome P450-2D6 enzyme responsible for their own metabolism, meaning that as fluoxetine and its metabolite accumulate in the body, they actively slow their own elimination. Fluoxetine behaves more like a zero-order drug at higher concentrations. Zero order, meaning that rather than an elimination rate that is proportional to the drug concentration, rather than a fixed percentage of that concentration, the drug is instead eliminated from the body at a more or less constant rate, regardless of its concentration. All of this means that it accumulates with repeated dosing, and that makes it ideal for an intermittent dosing schedule. In fact, I use Prozac for my patients who aren't good about taking their medication, who often forget to take their medicine, as insurance against steady-state concentrations that will fluctuate widely with compliance, that tend inadequate. Prozac is perfect for those patients. That said, any SSRI, Zoloft or Paxil, for example, with much shorter half-lives also work for certain symptoms, irritability chief among them. Fluoxetine is in fact useful not to replace estrogen and progesterone, but to treat the symptoms that come from going into hormone withdrawal each month, or for that matter in menopause. They also incidentally help with hot flashes in menopause, but especially with the symptoms of irritability and resentment, of not letting go of something that's upsetting, of dwelling and obsessing, as we often do following a disagreement with a loved one. When we're angered and we're still angry, we're holding on to the anger, or rather, the anger is holding on to us. Those symptoms, those emotions can be mitigated in the short term, and I'm talking ultra short term, after the fact even, once you're already upset, even if you haven't been taking the medication on a regular basis. Even SSRIs with much shorter half-lives than Prozac, and even for anxiety, a symptom which normally requires higher doses and much longer time periods to come into remission. For a lot of individuals with anxiety disorders, inconsistent dosing can actually exacerbate their symptoms. So this strategy is not for everyone. But I once took a PRN dose of Paxil as I headed off to bankruptcy court. I was representing myself, so I didn't have a lawyer, and I was extremely nervous, waiting for the judge to call me. And then, quite suddenly and very unexpectedly, I felt my pounding heart and my sweaty palms just quit, and a wave of calm washed over me. It was like a switch had been flipped. And it was no placebo response, because it was wholly unexpected and took me several minutes to realize that it was the Paxil that had done it. Without any effort on my part, I calmed down significantly within a matter of seconds. I can't guarantee that reaction in all individuals. I do recall that at the time I was also taking Lexapro, I believe, on a fairly regular basis, but Paxil is more potent than Lexapro, and that single PRN dose made a difference, a noticeable difference. In general, however, for anxiety, consistent dosing is the recommendation, and absolutely for endogenous anxiety. Anxiety that is innate, genetic, lifelong, and typically severe. But when we're talking about anger, when we're talking about redirecting your mind and letting go of resentment, those first few moments after a fight with a family member, it will make a huge and immediate difference. That very minor increase in serotonin from a single dose, or especially an extra dose, that's only going to last a few hours when you're not at steady state. PRN doses will not only improve frustration tolerance and decrease irritability, but also confer both the willingness and the capacity to forgive a loved one, especially over some minor slight. And so if we're talking about irritability, if we're talking about acute anxiety, job interviews and such, or if we're talking about dwelling and not being able to let go, the anti-obsessional properties of serotonergic medications, and specifically mechanisms that block the reuptake of serotonin, can be highly effective day to day on a strictly PRN basis. It's unorthodox, but it works. I've used the technique for decades with my own patients, and I've experienced it myself, and I have OCD. When a neuron releases serotonin into the synapse, the gap between neurons where communication takes place, one method of terminating the action of serotonin is that the neuron that releases it takes it back up. If we block that mechanism of clearing serotonin, the concentration in the synapse is greater and the actions of serotonin prolong. There are other ways of increasing the actions of serotonin, but in my experience, this appears to be the superior mechanism for treating anxiety in terms of serotonin. We can't compare it with using Xanax, for example. Now again, the full effect of these medications takes several weeks, so I'm not trying to disagree with the fact that certain conditions require daily dosing, and they get better slowly over time. Definitely there are conditions in certain medications where it's worse to take the medication some days and then forget to take it other days. All right, I can't say that too many times. I want to be very clear. Okay, I'm not sending that message for those practitioners out there that might get up in arms about this. Not all SSRIs are created equal, and some of them have significant physical withdrawal as well, such as Paxil and Lexapro, which isn't dangerous, but it's very uncomfortable and can last for days and days, and then abruptly discontinuing any of them, with the exception of Prozac, could lead to rebound symptoms, especially irritability and anxiety. So definitely, sometimes it's not a good idea not to take it every day. It really depends on the condition, the target symptom, and the individual, and sometimes other factors coming into play. It's not something that I can give you a recipe for. Definitely confer with your provider. What I'm talking about in this video doesn't apply to everyone who's on an SSRI, and those who need to be on an SSRI for the rest of their life because they suffer from from panic disorder, or because they have OCD, or because they experience recurrent major depressive episodes, and we know they're going to have another episode because they've had so many and they're getting worse, so we need prophylaxis against those recurrences. This doesn't apply to those individuals. This applies to average, everyday, high-functioning people that don't have a major mood disorder, an endogenous major mood disorder like bipolar disorder, major depression, or a major anxiety syndrome like social phobia or PTSD. So those individuals are exempt. But especially if the target symptom is, in order of appropriateness and effectiveness, irritability for sure, because that one responds to a single dose. Acute, uncomplicated anxiety, such as walking into a job interview or a courtroom, you're still maybe nervous, but you can just feel it come down when it kicks in. And especially getting over the fight that you just had with your sister or your spouse, and being in a more forgiving mood. Hopefully that happens with time normally, but for some people it takes a long time. And even if you're not one of those individuals that stays upset for days and days, a dose or two of an SSRI that you haven't otherwise been taking can still help put you in a better mood so you can be the bigger person. You can be kind, and you can reach out to apologize for your part of it and or forgive their part, whether or not they apologize, when earlier you were definitely not willing to do that. I have patients for whom I might say, no, we're either going to take it every day or we're not going to take it, because not taking it every day could backfire. But for high-functioning individuals who have awareness and insight, who aren't impulsive, and who can control their anger most of the time, PRN doses of serotonergic medication really mitigate those negative emotions. There's no reason to be feeling them. There's no reason to be feeling resentment. That only hurts you, not the object of your rancor. So if you don't want to take an SSRI every day, usually because of sexual dysfunction, people don't like it, or it makes you tired, you can take it when you need it on a case-by-case basis. And especially individuals who are taking the medication every day, they can take an extra dose, a booster. If they don't want to be on 100 milligrams of Zoloft every day because it causes anorgasmia or lethargy or middle insomnia at that dose, but they do okay on 50, there are some days they might need 100, such as for some women during the luteal phase of their cycle, or for anyone on extra stressful days, or when you're really nervous about a meeting or giving a speech, performance anxiety, or if you have a big fight and you're not ready to get over it. It really accelerates that process in particular. It shortens the amount of time that it takes for you to get over it. Because if you know you're going to get over it, you've been married for years, you have a spat, and you're digging in your heels, and it's ruining your day, it's ruining your day, not your spouse's. You're dwelling, and you don't want to call and say you're sorry or send a text. Within an hour or two of taking a dose, if that's your goal, to be in a better frame of mind so that you can reach out and say you're sorry and forgive, it works. In the majority of cases, if that's your intention, if you have that insight, it works. So there's no reason to put up with side effects that could be chronic, like sexual dysfunction, temperature dysregulation, hot flashes, or middle or terminal insomnia, etc. There are certain side effects that can last weeks and months, and some that never go away, so long as you're taking the medication. So, for example, sexual dysfunction. For a lot of people, they reach a certain level, and unless we do something with the dose or use an antidote, they're not going to be able to climax. Or for postmenopausal women whose libido has been annihilated by the medicine. There are ways of mitigating those side effects, but one option for certain symptoms, for certain patients, is to not take the medicine all the time. And it's really not talked about. It's typically frowned upon, but it works for certain individuals for specific target symptoms. It doesn't work, for example, to prevent panic attacks. Just taking it here and there, not going to do it. Could make it worse. It doesn't work with moderate to severe OCD, obsessive compulsive disorder. That condition is stubborn enough. Extra doses can help diminish social anxiety on a day-to-day basis if there's already a baseline. I wouldn't have too much confidence in a single dose there. That I've never recommended. In social anxiety disorder, that unease is pervasive. It's more or less present all the time. It can wax and wane, but the only PRN that I would recommend in that case would be very low-dose Xanax. But serotonin is calming. It brings you into the present moment so that you're not worrying about things that aren't happening or that have already happened. You're not dwelling, you're not obsessing. And that includes about the future, anticipatory anxiety. But, there's a certain symptom that you see it a lot in OCD and other anxiety syndromes in which a person is hurt and they sincerely believe in that moment of angst that they will never get over it. And they say as much, and they believe it. And when it's irrational, it's because they don't have enough serotonin. And it's part of their syndrome. And when you give serotonin, it cures that specific symptom of believing that you're never going to get over it. You come to believe that because you begin to get over it. Because that's what serotonin helps you do. In as much as dopamine and norepinephrine may cause you to dig in your heels and be angry and be so angry that you don't want to not be angry. You feel entitled to your anger. You don't want it to end. You know, anger has a way of doing that, of self-propagating, just like anxiety, as a matter of fact. But when you take serotonin, you are more forgiving. You can let things go. It's easier to forgive. And so if you're really struggling with that in particular, of letting something go and getting over something, whether it's because you have OCD or whether it's because you just happen to be obsessing about it and you just can't get over it, but you want to get over it, it's your best friend or it's a family member you're close to and you feel like it's ruining your relationship, but you feel compelled to think about it and to resent it, and you let it go for a little bit and you make a conscious decision to forgive, but then it creeps back up and later down the line it pops into your mind again, an intrusive thought, and there it is again and you just can't get over it. You see that a lot with spouses that their partners have been unfaithful, and the husband who's been cuckolded that wants to forgive and goes through the motions of consciously forgiving on a certain intellectual level, but then he just can't get over it. As a man, a lot of times there's a double standard there and men can't get over it, but they want to, and they need medicine. They need medicine or they might get divorced. It might ruin their marriage. And it's not even about trust. It's not even that they believe that their wife is going to continue to have an affair. It's that they just can't get over the one time, even when they themselves have been unfaithful. And they recognize that it's unfair, it's irrational, but they cannot help it. They cannot control it. They cannot control their mind. Not necessarily because they have OCD, but because of the way they were reared, because of the cultural brainwashing that occurs. And they need medicine. The medicine they need is a selective serotonin reuptake inhibitor, which will help them stop obsessing and will help them banish that thought, and it will help that thought to stay out, because that's what serotonin does as well. When you're obsessing about something, again, whether you have OCD or not, but especially if you do, and you banish a thought, but then it keeps creeping back in. You don't want to think about it because you're at work, you're doing other things, there's nothing you can do about it, and you decide not to think about it, but then you just have to keep, it's like a song that keeps playing in your mind that you can't get rid of. It keeps coming into your mind, and that's actually a parallel process. That happens when you have too much dopamine. When I take Wellbutrin, I get stuck on a song, and all day long, all morning long, I'm stuck on the song. Serotonin will ease that, and serotonin will ease intrusive thoughts. Serotonin is perfect for that. I especially, though, recommend it for anger. It works at very low doses, and I mean immediately, just as soon as you start absorbing it. It's a perfect Band-Aid. It's more than a Band-Aid, it's a salve. It takes you out of that, and it sets you free. No matter how stubborn you are, no matter how much of a person who tends to hold on to grudges you are, just because of your temperament, do it for you. Do it for your loved ones. In the worst case scenario, you might not be able to orgasm later that day, but you're not going to gain weight with doses here and there. You're not going to be tired all the next day. It's a one-time deal, one at a time. And it can be every few months or it can be every few days. Obviously, consult with your prescriber, but if you have those symptoms, try it. If you're my patient, I can tell you more about it and how it applies to your specific case, whether or not it's advisable for you, or you can book a non-medical consultation with me to discuss your situation. The link is in the description below, but it's a good way to get what you need when you need it, but not have to sacrifice quality of life to a bunch of deal-breaker side effects. Thank you for listening. As always, questions and comments are welcome.